Hello, everybody. This is Gary. Today is October 4th, 2021. It is 5:57 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia update for today. I just wanted to go over some of the symptoms I was experiencing today. I was pretty busy today running around doing errands. Had to go to Star Memorial Hospital to do a stool sample because I might have parasites in my stool. But other than that, my schizophrenic symptoms were pretty intense today. I got everything done without incident that I was supposed to get done today, but my paranoia was running pretty high. My anxiety was running pretty high. My hallucinations were running pretty high. Not so much depression. That's not really a problem today. But I just took my night medications early to try to calm myself down and reduce my hallucinations. I took some Zyprexa for my psychotic symptoms, which include the hallucinations and paranoia. And I took half a milligram of Klonopin for my anxiety, along with my regular night medications, which include 600 milligrams of Seroquel. Seroquel acts as both a mood stabilizer, um, prevents fluctuations in my mood between mania and depression, but it's also an antipsychotic. It helps with the paranoia and hallucinations. Um, I also took my gabapentin, also known as Neurontin. I take Neurontin as an off-label prescribed use for anxiety. I take Tylenol on a regular basis for headaches. Um, there's a couple other medications that I take. I take blood blood pressure medication because I have high blood pressure. I'm still smoking cigarettes. I'm still trying to quit. Gonna give it another try tomorrow. Still smoking about 2 packs of cigarettes a day. I keep bouncing back and forth between quitting and not quitting, and it's getting very expensive to buy cigarettes in New York State with all the taxes. They're about $15 a pack. So it's starting to eat away at my savings. Um, and I need my money for other things like my medications, but I can't afford on cigarettes. I can't keep spending money on that. I do have nicotine lozenges to help me quit smoking, and I'm going to try to restart my quitting tomorrow. It's best if you're going to quit smoking, to set up a quit date ahead of time and plan for a while before you actually do it. So I will give that a try again tomorrow. Tomorrow I have to go back to Star Memorial Hospital to actually drop off that sample. I have to do 3 samples over the next 10 days to see if there are any parasites in my stool. There probably isn't, but my gastroenterologist wants to make sure that there isn't. Um, but my schizophrenia is pretty much under control. I'm just having some pretty paranoia. I was on the bus today, and I was paranoid that people were looking at me, criticizing me, spying on me. Kind of thing is kind of common for me, especially when I'm in public and I'm under stress. Um, it's very distracting to be out in public and think people are spying on you or following you. Um, I don't go up to people and actually accuse them of following me. I used to do that, and a few times I almost got the crap beat out of me, so I stopped doing that. I have enough control over my behavior not to accuse of the people following me, no matter how intense my paranoia is. I've learned to control my behavior. Um, and taking Zyprexa um, helps with the paranoia and helps calm it down a bit. And the Klonopin helps calm down the anxiety a bit. Um, Other than that, I'm pretty agitated by politics. As an atheist, I can't seem to separate myself from politics. I consider myself to be a secular humanist and an atheist, and I'm really against right wing Christian nationalism politics of the far right. I sometimes do videos on this subject. I did one today. I uploaded it a couple hours ago. It's on my YouTube channel if you want to take a look at it. Um, I support a woman's right to abortion, and that's part of what the video is about. Um, and if I watch too much news, whether it's on YouTube or on TV or some other news source, I tend to aggravate myself about politics and religion and other issues that take place in the political arena. Kind of agitates my anxiety, kind of agitates my paranoia, kind of agitates my hallucinations. Stress can do that. So I'm going to try to lower my consumption of news and politics and things like that. Although I don't want to completely stick my head in the sand and not stay up on current events. There's a lot of things going on in Washington, D.C. There's a lot of things going on in New York State. Um, New York State has a vaccine mandate for all of its healthcare workers, and a lot of people have been fired from their jobs for not getting vaccinated in the healthcare industry, and not just in New York. A lot of labs through the University of Rochester Star Memorial Hospital are closed because they don't have enough staff, because the staff were either fired or they quit because they didn't want to get vaccinated. I don't know if that's right or wrong. I really don't have an opinion. I myself did get vaccinated. I got the Pfizer vaccine. I got both the first and second shot back in May of this year. I think it's May and June, 30 days apart between the two shots. If they offer a booster shot, I'll probably take that too. Right now, they are offering a booster shot in New York State for people 65 years or older or people who have pre-existing conditions. I don't really have a pre-existing condition that would allow me to get a booster shot or to qualify for a booster shot. Schizophrenia and schizoaffective disorder doesn't qualify as a pre-existing condition. But I'm totally for vaccines. I think they're perfectly safe. I have had no side effects from getting vaccinated against COVID-19. Um, and I also probably should get my flu shot pretty soon. They offer those at Walgreens Pharmacy, and I go to Walgreens Pharmacy for my uh, prescriptions, and I can get my flu shot there too, I believe, as well. I encourage other people to get their flu shot. But anyways, not much else really to talk about. Just under a lot of stress, under a lot of hallucination, a lot of paranoia, a lot of delusions, coping the best I can. A psychiatrist is on vacation. Actually, he's taking time off to take exams, and his anniversary is coming up, so he's going to be out for a while. I do have a appointment with a new psychotherapist, which is separate from my psychiatrist, day after tomorrow. Um, I'm not sure if it's just a temporary therapist, and then they're going to assign me to somebody permanent later, or the person I'm seeing day after tomorrow is going to be my permanent psych therapist. Either way, I'll have a permanent psychotherapist, and I specifically asked for a female psychotherapist. So that's what I'm hoping for. A psychotherapist is just somebody who does talk therapy. And not really a person that coordinates medications or prescribes medications. A psychotherapist usually is not a psychiatrist, and they usually don't have a medical degree, so they don't really have anything to do with prescribing my psychiatric medications. So I've been going in and out of the psychiatric emergency room lately. I went again about 3 weeks ago, and having a psychotherapist might reduce my visits to the psychiatric emergency room at the University of Rochester Memorial Hospital. The last time I went to the psychiatric emergency room, it was packed. There was 45 people packed into a very tight area, meant for 20 people. And it's a locked facility. Once you're there, even if you go there voluntarily like I did, you don't get to leave until you talk to the psychiatrist. And it took me 26 hours before I was able to talk to a psychiatrist and get discharged. And like I said in one of my other videos, what they did for me there was they gave me over 26 hours 10 milligrams of Zyprexa for paranoia and hallucinations, 100 milligrams of Seroquel for anxiety and sleep and psychosis, 4 milligrams of Zofran because I started vomiting from anxiety. They gave me 2 Ativan for anxiety and 2 Klonopin for anxiety. Both Ativan and Klonopin are benzodiazepine medications for anxiety. They can be physically addictive, mentally addictive, and me and my psychiatrist are keeping an eye on how much Klonopin I take so I don't get addicted to it or dependent on it. We're planning to review it in December, and we'll probably take the Klonopin altogether at the beginning of December, and right now is October. So I will be seeing my psychiatrist on November 11th, and between now and then, I will have a psychotherapist to see in the meantime, so I won't be totally without psychiatric service between now and November 11th. I will have a top therapist to be seen during that time. I think it's important for people with schizophrenia to have a psychotherapist as well as a psychiatrist. For the past 2 or 3 years, I have been seeing just a psychiatrist and not a therapist, and that's not really a good idea. So I'm going back to seeing a psychotherapist as well as a psychiatrist. A psychotherapist, by the way, could be just about anybody with psychiatric training, a psychiatric nurse, a psychologist, a social worker. It depends on the person and their training. So I'm not sure what kind of training the psychotherapist I'm seeing day after tomorrow has. They will have some sort of degree related to psychiatry or psychology, whether that's a master's degree, a PhD, a nursing degree, whatever it might be. They're trained in psychotherapy and they're trained in talk therapy. And I think it's important that if you're a schizophrenic or you have schizoaffective disorder or some other psychotic disorder, that if you're seeing a psychiatrist, don't make the same mistake I did and make sure that you have a psychotherapist for talk therapy as well as seeing a psychiatrist. That's all for now. Like, share, subscribe, press the notification bell so you'll know when I put out a new video. And if you want me to do a video on a particular topic, let me know in the comment section.